It's a pleasure to welcome you today. First of all, I want to thanks to the organization committee and especially Gabriel for the invitation. Today I will talk about the masking protocol for the assessment of plantar pressure, measurement of the forefoot, and especially for the evaluation of the efficacy of foot orthosis with patients suffering from forefoot pain. Forefoot pain is a common complaint in podiatry, and different types of foot orthosis are used to treat this forefoot pain, especially custom-made or metatarsal pads. In shoe plantar pressure are commonly used to evaluate the efficacy of this foot orthosis, but different masking protocols are used to evaluate the effect, explain the effect of this foot orthosis. So the objective of the presentation of the study today is to define the different masking protocols used to evaluate and explain the efficacy of foot orthosis for patients with forefoot pain. So we conduct a systematic review with PRISMA guidelines. We used PubMed, Web of Science, and Cochrane Library database with keywords and medical subjects like forefoot pain or metatarsal pain, and insole, foot orthosis or foot orthotics or metatarsal pads, and foot pressure or plantar pressure. To select the study, we focus only on studies with a population of forefoot pain or history of forefoot pain. Only studies with in-shoe plantar pressure measurement system. Only study we analyze the gait, and only study with typical pressure data parameters like maximum peak pressure, maximal mean pressure, or pressure time integral. First of all, we screen the title and read the abstract. And after that, full text was screened for selected studies. And in conclusion, we extracted different characteristics of the study. So it's population characteristics, intervention, masking protocol, main outcome parameters, and main results. So let's take a look at the results. At the beginning, we have 321 studies with 111 duplicated study. So the study was removed. So we screened 210 studies. After title and abstract screening, we excluded 152 studies. So 34 full-text article was assessed for eligibility. 25 study was excluded for the different reasons, and only 9 studies were included in the qualitative synthesis. First, for the result, all of the study used a typical pressure outcome like maximal peak pressure and pressure time integral. So, for example, for the forefoot excluded tools, it's a typical graph of forefoot pressure during the stand phase of the gait. Maximal peak pressure, maximum peak pressure, it's the highest point, highest value of the curve during the stand phase, and PTI, pressure time integral, represent the area under the curve. It's the cumulative effect of the pressure during the stand phase. For the masking protocol, studies use traditional or classical masking protocol. So it's a protocol where the plantar areas were defined with fixed percentage of the foot length or width. Different level of traditional masking protocol are used in this study. It depends on the number of forefoot areas defined, and especially the medial lateral split of the forefoot. So, for studies used only one forefoot area, and 3 studies used 3 forefoot areas. The second type of masking protocol, it's an anatomical masking protocol. So plantar area defined with a relative position of each metatarsal head. This technique uses a carbon insole in static position. And the number of area depends of the split of the forefoot along the anterior-posterior longitudinal axis of the foot. So in this systematic view, we have 2 studies. We use 3 forefoot areas along the longitudinal axis of the foot. So let's take a look at the details. For traditional masking protocol, with just one forefoot area, we have 4 studies and forefoot excluded toes. So metatarsal heads are defined with percentage of the foot length. So metatarsal heads, this area is defined between 60 and 85% of the foot length, or between 50 or 80% of the foot length. So globally, the study show reduction of peak plantar pressure or pressure time integral in function of the different intervention, so like custom made or metatarsal pad. An example of a study is Lee, used just one forefoot area under the foot. So he compared different intervention like metatarsal dome or bar or plantar cover, and each of the forefoot pad significantly reduced the forefoot peak pressure, but it's difficult to show where the pressure is reduced, and it's impossible to identify a mechanism of pressure transfer. The second traditional masking protocol is 3 forefoot areas. We have 3 studies. The study split the forefoot area along a major lateral axis of the forefoot to identify, for example, the first metatarsal head, the second metatarsal head, and the 4th to 5th metatarsal heads. Second study used the area underneath the first metatarsal, second, third, and 4th metatarsals, and the third area is the 5th metatarsal. And the last study used medial, central, or lateral area beneath the forefoot. So this study, an example of study is this masking protocol is used to identify a mechanism of medial lateral pressure transfer with different intervention. So in this example, you have a significant reduction in peak plantar pressure beneath the central metatarsal head, and it's possible to identify a mechanism of pressure transfer from central metatarsal head to lateral or medial metatarsal head. Finally, the last masking protocol, it's an anatomical protocol based on the relative position of the metatarsal head. So we have 2 studies of the same team, and they used masking protocol along the longitudinal axis of the foot to have 3 areas under the forefoot, like distal, beneath, and proximal to the metatarsal heads. This study is used to identify a mechanism of longitudinal transfer of the pressure. So in this example, we used a metatarsal dome. So the pressure under the distal underneath, the distal and beneath the metatarsal head is decreased, and the pressure underneath the proximal to the metatarsal head is increased. So you can, when you use this type of masking protocol, you can identify a mechanism of pressure transfer along the longitudinal axis of the foot. To discuss how to make a choice between these different types of masking protocol. So traditional masking protocol, it's the same masking protocol for all the patients. So it's possible that it's limitations for the definition of the different area of the forefoot. Anatomical, it's a personalized masking protocol to patients, but it's necessary to have time to do these techniques. So to choose the masking protocol, it depends on the objectives of the study. It's a clinical application, clinical practice, or it's a research. And we need to have more studies to conduct meta-analysis. To conclude, the choice of the pressure masking protocols depends on the objective of the study. So, for example, the aim is to evaluate the global efficiency of the foot orthosis. Perhaps it's possible to just use traditional masking protocol and just have one forefoot area. If you need to identify the mechanism of pressure transfer, you can use multi-masking protocol, traditional for major lateral mechanism of pressure transfer, or anatomical to identify the longitudinal pressure transfer. And if you have if you are a podiatrist, if you use foot pressure in your clinical practice, perhaps it's difficult to use anatomical because you don't have time, for example. And it's very important for a researcher to improve this type of masking protocol, and and company to develop and to implement the different type of masking protocol in the software, for example. Thank you for your attention.